webcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Thank you for joining us today, February 9th. Excuse me, it's February 24th, 2021, and we are on a webinar with the Department of Family and Support Services to discuss RFP number 7827, which is within Senior Services, the Caregiver Support and Counseling Services RFP. So thank you for joining us today. You'll see some specifics here on the slide. My name is Karen Cobb-Flood, and I'm the manager at Family and Support Services and Senior Services. And I am delighted to be talking to you all today. And now I will invite my colleague, Tom, to just go over some housekeeping issues before we get started.
All right, thanks a lot. Yep, thanks, Karen. Hey, hi, everyone. My name's Thomas Mose, or I go by Tom, and I work at the Department of Family Support Services. I'm actually in a different division, but one of my roles is to support all the divisions at DFSS because we do these RFPs, and our our GoToWebinar account, I manage that, and I will provide any technical assistance today. So I wanted to let you know that due to the volume of participants, we had a great sign up, that everyone's been placed on mute. So we want to get your questions, and to have you give those to us, we want you to use your question box to type in your questions, and we'll respond to them after going through all the slides. And that if there's any technical issues, you can type in your questions, and I'll try to individually respond to you, or I'll either ask to speak out loud during the presentation if I can assist anyone. So with that, I'm going to help guide the presentation today, and I'm going to pass it back to Karen and let her take it over. So thanks a lot, everyone.
Thanks, Tom. We really appreciate your being our MC and host today. So let's see. This is our agenda in front of us today, and you'll see we're going to cover a broad variety of things today. First, I'll go ahead and again, welcome you all. Thank you for joining us today. This is a very exciting day for us at DFSS, and this is kicking off our RFP season for between now and the end of the year until September 30th. We'll be doing a lot of RFPs, and so we hope that you'll continue to come and join us and learn about the new and exciting projects that we have going within Senior Services. So again, my name is Karen Cobb-Flood. I'm manager of Senior Services, and my portfolio consists of a broad variety of in-home supports that help older adults and their caregivers age well within the city of Chicago, to remain independent, and to really work with delegate agencies to move forward and support our seniors all across the city. So I'm delighted today to be presenting with my colleague Stacy Subita, and Stacy is actually supervisor at Family and Support Services, and she handles our caregiver portfolio and also our chore portfolio. And so we'll be kind of co-hosting today and going back and forth with some of the specifications on the new RFP, and are really looking forward to having this discussion with you all. I know Tom mentioned that if you have questions, we encourage you to put them in the chat box, which is on the sidebar, and you'll type those in and we'll answer all of those at the end. So thank you again. You see, we'll talk about the purpose, the background. We'll talk specifically about the scope, the program description. What are some of the selection criteria for respondents? What's our timeline? That's always very important. We urge you to keep to that. And then additional, how we provide technical assistance for applicants and e-procurement. And I would be remiss if I did not mention my colleague, Julia Talbot, who'll be talking about some of those more specific aspects. So Stacy and I will handle kind of the program aspects, and then Julie is going to talk really about the technical aspects of the application, and then Tom will just be overseeing us throughout, I imagine. Okay, next slide, please, Tom. Thank you. All right, so let's get started. So the purpose of this RFP today is to help caregivers of any age access services, support, and assistance with managing and navigating the challenges of caring for a loved one. So this is a part of our programming that complements everything that Senior Services does. Caregivers are a crucial support for older Chicagoans as they age in the community, wherever they may live. To that end, we're seeking proposals from qualified social service agencies that have experience providing the important aspects of this program. So counseling, support groups, and gap-filling services for caregivers of any age who provide informal care to an individual age 60 years of age and older, or an individual who's 18 to 59 with Alzheimer's disease or a related disorder with neurological or organic brain conditions. And again, we provide those supports through counseling, support groups, and gap-filling services. Next slide, please, Tom. Okay, so before we get started, of course, some background. We, of course, are within the Department of Family and Support Services. We are the City of Chicago's primary social services funder and administrator. We manage a comprehensive client-oriented human service delivery system that really takes a holistic approach to improving the quality of life for our most vulnerable Chicagoans. We administer resources and provide assistance and support to a network of over 350 community-based organizations. Our mission is to work with our community partners, like you all on this call. We connect Chicago residents and families to resources that build stability, support their well-being, and most importantly, empower them to thrive. Our priorities are to deliver and support high-quality, innovative, comprehensive services that empower their clients to thrive. We collaborate with our community partners, sister agencies, and public officials on programs and policies to improve Chicagoans' lives and advance systemic change. We inform the public of resources that are available to them through DFSS and its community partners. And of course, we steward our resources through DFSS responsibly and effectively. Now, one of the things that's very important to remember during this RFP is that DFSS as a department is truly committed to moving beyond measuring how many people receive services to really focus on whether Chicagoans are benefiting from receiving the services. And so as part of this outcomes-oriented approach, we've implemented a strategic framework that guides how we measure, report, and review our priorities and outcome goals, and use them to drive our contracting, our decision-making, and greater collaboration. So the Senior Services Division is one of 7 programs within DFSS. And as you can see from the content on this slide, we are, of course, the designated local area agency on aging for the City of Chicago. And as the AAA, we coordinate and fund services for older adults. And we, of course, prioritize those in the greatest economic and social need, those who live alone, and those who are at risk of institutionalization. And we work with our aging peers, aging network partners, and we are guided by supporting older people to live independently in their own communities and homes for as long as possible, ensuring that those who reside in institutions are treated with dignity and care, and of course guaranteeing that older people have access to accurate information to participate in public policy. So you are a part of this journey with us, and together with our service providers, we provide vital information and assistance, congregate and home delivered meal services, senior centers, fitness classes, and the broad variety of services that you see here. And of course, caregiver support is an essential part of this. In keeping of the spirit with this new RFP, we continually strive to innovate and advocate for our residents so they may continue to thrive as they age in place. We value integrity and respect, as well as promoting social engagement among older adults as the antidote to dependent social isolation and withdrawal. Next slide, please, Tom. So the goals of this, back to our caregiver RFP. Caregiver and counseling and support services has a lot of goals here, as you'll see. We have 6. Alleviating caregiver stress and social isolation. I know that we all know from the review of the literature and the caregivers and older adults that we work with ourselves that stress and that social isolation happens just by being a caregiver. We want to empower caregivers to solve or cope with problems caring for the care recipient. We want to improve the caregiver's health and wellness. We want to increase awareness about caregiving, increase the caregiver's confidence or self-efficacy to continue to provide care for their loved ones. And we want to delay premature institutionalization of the care recipient. So that said, I'm going to invite my colleague, Stacy Sugita. Thanks for joining us, Stacy, and I'll invite you to get started with the next slide, which is target population. Thank you, Tom.
Great. Thank you so much, Karen. Can everyone hear me?
Yes.
Okay, wonderful. Okay, so as Karen and Tom have introduced us, my name is Stacy Subita. I'm Supervisor of Family and Support Services, specifically with the Caregiver portfolio. And as we mentioned today, this piece will be focusing on the counseling and support services. So we're going to delve in here a little bit to the target population. And so a caregiver is considered a person that is informal or unpaid individual. So this can be a family member or a friend who is providing care to the older adult or a person with disability. They do provide ongoing assistance with activities of daily living as well as instrumental activities of daily living. So these are things like helping with bathing, grooming, dressing, meal preparation, shopping, cleaning for that care recipient. The city is committed to providing equitable access to all residents, and so the applicant must have a well-developed service delivery plan to include programs offered in all parts of the city of Chicago, including the north, south, west, and central regions, and as many wards as feasible where caregivers are identified to live. They will have to provide outreach efforts and in-person program locations, which can include locations such as libraries, senior centers, and faith-based organizations. And they can have a combination of paid staff, subcontractors, in-kind, and volunteers to be able to reach as many Chicagoans as possible. Caregivers are prioritized based on the Older Americans Act, Title III priorities, which states the preference for older adults who have greatest economic or social need. And our Older Americans Act federal funding dictates that respondents should be paying particular attention to caregivers who may be in underserved communities, so either low-income minority communities or individuals with limited English proficiency. The services are to be provided throughout the whole city of Chicago. Next slide, please. So as we look at the program requirements, this program is composed of 3 categories: the individual and family counseling, group therapy and support groups, as well as the gap filling services. The counseling sessions would be led by a licensed clinician who is able to provide counseling on a variety of topics, such as grief, anxiety, transition into their caregiving role. We intend to have the support groups to provide emotional and peer support to caregivers, and then gap filling services, which includes goods and services that will complement the care provided by the informal caregiver when all other resources have been exhausted. So in this case, for example, like incontinence supplies, grab bars, things in the home that would be needed. The selected respondent will be responsible for the program management of the program, so including things such as the outreach, assessment, program implementation, retention, and data collection on the impact of programs on the caregivers that are going to be served. We need to consider planning considerations for cultural adaptations to caregiver interventions where needed, and inclusion of citizens from a local community in planning and adaptations or improvement to the caregiver program is encouraged. The respondent will need to provide services for caregivers, including those with limited English proficiency, and they will need to have access to staff with language skills that reflect the needs of the caregivers or translation services available. The respondent must also make reasonable accommodations for caregivers with disabilities, including American Sign Language interpretation and or TDD, TTY phone number, or other telecommunication devices for deaf and accessible facilities for individuals with physical disabilities. The annual budget for counseling sessions for this program will be $30,000. The annual budget for support groups will be $40,000, and the annual budget for gap filling is $46,200. Because we are releasing this mid-fiscal year, it will be prorated funding for for the selected respondent for the remaining of 2021. Next slide, please. So program requirements. We are offering an optional service of training and education in addition to the counseling, support groups, and gap filling. Occasionally, DFSS may have additional or carryover funds, and should this occur, we would like to provide additional funding to the delegate agency to provide training and education, which offers opportunities for caregivers to increase their knowledge and skills and abilities to cope for caring for their loved one. The sessions could be through webinar, in-person classes, workshops, or conferences. And it is also a way to conduct outreach to promote further programs. Topics could include, but are not limited to, personal care training, health and wellness education, technology assistance, financial planning, advocacy and legal issues, and long-term care supports and services. If you are interested in being considered for additional funds if they become available, we are asking respondents to briefly describe their aims for caregiver education and training and why the organization is best placed to deliver such a program. They will also have to indicate if the organization has capacity to implement the funds with limited notice. And the annual budget will be dependent upon available funding. Next slide, please. The City of Chicago, as we said, is committed to reducing disparities based on race, color, national origin, age, gender, sexual orientation, religion, disability, or other potential discriminating factors for citizens. DFSS serves a diverse population of older adults and their families, and the respondents will be asked to collect demographic data for DFSS to continue to monitor how the citizens are best served. They can do this by incorporating information into the application from a needs assessment of family caregivers serving, but it's recommended but not required. This could be done through things like focus groups or surveys to determine which programs might have the most success in a local community. Next slide, please. As we are all experiencing the recent coronavirus pandemic, we do want to place special emphasis on contingency planning for any type of emergencies that can require a change in programming, registration, locations, times, etc. Not only for the pandemic, but also other things, other emergency situations such as weather, so winter storms, tornadoes, heat waves. The selected respondent should develop policies and procedures to include sections on training, PPE, health screenings, temperature checks, etc. And it should be in accordance to the CDC, IDPH, and the Federal Emergency Management Guidance. For example, this year, we had to make the transition from in-person interventions into other methods such as virtual. And, until the local officials deem that in-person programs are safe again. Okay, so next slide, please. So we at DFSS, we want to track programs and progress towards achieving the outcome goals of this program so that we are able to assess the success of the program. And so these are the types of things that we will consider as performance indicators. It includes, but is not limited to, 80% of caregivers who participate in our caregiver counseling and support services will feel a reduction in stress levels. 80% would have learned one or more strategies or techniques to cope with caregiving problems. 80% self-reporting, improved health knowledge or improved health indicators from before the intervention as applicable. 80% of caregivers feeling an increase in confidence to continue providing care for the care recipient, as well as 80% of caregivers feeling more aware of caregiving supports and services that are available to them. Next slide, please. To monitor and recognize the progress of the performance measures, we also track our output metrics. And these include but are not limited to, and will be modified to match the RFP application. We look to do 150 assessments annually, 30 participants and 250 units of counseling services provided annually, 70 participants and 156 units of support groups to be provided annually, as well as 100 clients and 100 units of gap filling services to be provided annually. Next slide. In order to do the program evaluation piece, we will be conducting satisfaction surveys. And so the selected respondent has to have procedures for evaluating and reporting the client's satisfaction with the delivery of service, as well as the satisfaction with the outcomes of the service. The respondent will administer a survey measuring client or family satisfaction, which would be developed with the approval of DFSS, and report the results of the survey and receive feedback on services on a quarterly basis. And so the results of those surveys must be shared and reported to DFSS on a quarterly basis. So with that, I am going to turn it back over to Karen to discuss our selection criteria. Thank you again all to everyone who is participating on today's call.
Thank you, Stacy. That's great. So we're going to transition a bit to the selection criteria and the overview. So this is important for folks. How will we be scored? How will our applications be evaluated? And honestly, we really look at some multiple criteria, including the total number of people you expect to serve, and then also the importance of having that plan for regional service delivery. And so we encourage you to include best practice and evidence-based interventions, an outreach plan, and a training and implementation plan for how you'll supervise and support your team and also your support group leaders. So we are really looking for delegate agencies that have a capacity to increase the number of caregivers participating in caregiver counseling programs to ensure that caregivers are being supported. Next slide, please, Tom. So the strength of the proposed program. So as we look at the selection criteria, we will look to see if the services that are provided directly or through partnerships and linkages agreements with other agencies. So you can collaborate, of course, but we'll look to see that that respondent is appropriate to address the needs of and will achieve the desired outcomes for the target population citywide via the proposed model that you'll embrace. The respondent's program is supported by a strong national or local evidence base and or aligns with best practices for the relevant field. We'll see that the respondent demonstrates a clear understanding of the target population. So both older adults and the caregivers. And importantly also, any identified subpopulations, needs, and challenges. We'll also look to see that there's an effective approach to identifying and retaining program participants, and that will really include policies that reduce barriers to participation, effective training and education, implementation, and outreach plans. One of the thoughts also is that when you're doing your needs assessment, you might want to ask caregivers, what would reduce the barriers to your participation? So next slide, please, Tom. We're going to go on to performance management and outcomes. And in this aspect, we're looking for respondents that will demonstrate evidence of strong past performance against the desired outcome goals and performance metrics, and or other notable accomplishments in providing services to the targeted population. We will look to see that you have the relevant systems and processes needed to track and report your performance on program outcomes and, of course, impact. We'll look to see that you have experience using data to inform or improve the services and practices, so that an ongoing approach to getting better. And also that you have relevant systems and processes that are needed to collect and store key participant and performance data. Next slide, please, Thomas. So the selection criteria, the organizational capacity. Is your organization ready for this project? And so to assess that, we look to see that you have qualified staff that are responsible for program oversight and management. We look to see that the respondent has adequate systems and processes to support monitoring program expenditures and fiscal controls, that you have adequate HR capacity to hire and manage staff. Additionally, we'll look that the respondent has expertise working with the targeted population and the relevant capabilities and or infrastructure needed to serve caregivers. And finally, we'll look to see that your organization reflects and engages the diverse people of the communities that it serves. Next slide, please, Tom. Okay, so getting to money, reasonable costs, budget justification, and leverage of funds. So we would like a respondent to describe their auditing practice and if the award will be included in those practices. We'll look to see if you have the fiscal capacity to implement the proposed program. We'll see if you're able to leverage other funds and in-kind contributions to support the total program and administrative cost. And of course, that can include things like state, federal, foundation, corporate, or individual donations. We're looking for a respondent that demonstrates reasonable implementation costs and funding requests relative to the financial and human resources, and also that the proposed budget supports the proposed scope of work or work plan. Next slide, please, Tom. And so let's see, attachments. We will ask that you attach the documents that you see listed in the application, and you see these listed below. The job description of the program coordinator or director, the resume of the program coordinator or director, if applicable, the job description of the mental health clinician role, and the resume of the mental health clinician, if possible. Next slide, please. All right, so we are today, February 24th, 2021, at the pre-proposal webinar. And the applications are due in a bit less than a month, so March 18th, 2021. And this is important. They're due at noon, not close of business at noon. So next slide. And if that wasn't clear enough, the applications are due March 18th, 2021 at 12 noon. All right, thank you. Julia, may I invite you to take over from this point forward?
Sure. So my name is Julia Talbot. I am at DFSS, and I basically am the person that manages the RFP process for all of the RFPs that we do here. I've no doubt spoken to many of you over the years. And the next part of this presentation, which if you've been on a DFSS website webinar before, you'll recognize, is I basically am just going to go over how to do the application, the physical application process. So you've listened to Karen and you've listened to Stacy do an excellent job telling you about the opportunity that we're talking, for caregiver services today. I'm going to tell you how you actually go about making that application. You're going to, all of our applications are done in the e-procurement, online e-procurement system, or iSupplier. If you have never done business with the City of Chicago, you will need to register into iSupplier as soon as possible to get yourself set up. Doing the iSupplier application is pretty painless, but it does require that you submit sort of preliminary, some preliminary information, and then the Department of Procurement Services will set you up with an an application, or with a I'm spacing on the word, but they're going to set you up with an account. That's it. And then from then on, you'll be able to log in. But that does sometimes, if you're new to the system, that might take anywhere between a day to up to 7 days. Usually usually you'll get a response between around 3 days, but the Department of Procurement and the Information Technology do say that, to be forewarned, it could take up to 7 days if there's a rush. Now, just in terms of once you get your account into the e-procurement system, there's a lot of different things out there to help you, and I'll have links to those things. There's videos, there's step-by-step instructions, there's a helpline for anybody having a problem with e-procurement, and you can call me, and I might be able to help you as well. And our numbers and emails are on subsequent slides in this presentation, but then also pretty much all over the internet, and also in the RFP document specifically itself. It's it's pretty easy to get a hold of us. So what I like to tell people, my mantra for working in e-procurement is start early and save often. So I would start by really carefully reviewing the RFP document and narratives and application questions that we set up. We work very hard to try to be as clear as we can be on our scopes and narratives. We try very hard to come up with application questions that are truly asking us to, asking the applicant, which would be you, to provide information that we need to know to make a good decision as to who is best qualified to get our contracts and do the best job for the citizens of Chicago. And all of these things do roll up. So when you look at your scope and your application questions and the selection criteria that Karen just went over, remember, they're all interconnected. These things were developed in connection and concert with one another. They're not just sort of random, even though they might sometimes seem random, but they really aren't. We've thought about them actually rather closely. And let that guide you. So if you are reading an application question and you're like, don't really understand what that means, my first advice to you would be go to the narrative, go to the scope in the RFP document, and read it. Chances are you'll find some section that directly relates to that question that will give you guidance as to the kind of answer that we're looking for, the kind of experience or the kind of services that we are really interested in having one of our having in an applicant. The other thing is also look at the selection criteria. Every question in the application relates to a specific selection criteria. And it's usually aligned. There's different groupings of questions. There's different selection criteria also grouped out, on the 4 slides that Karen just went through. All of those things are interrelated. And so let those provide you with guidance. If you still have questions, feel free to call Karen or Stacy. You can call me for program questions, but I'm really just going to tell you to call Karen and Stacy, or I'm going to write an email and CC you and Karen and Stacy so that they can provide you with the answers. Also, and we'll go through this later, at the end of this presentation, there's a place that we can add, there's a place and a time for questions, and all of those questions will become part of the amendment, which is also published in e-procurement that you have to accept as part of the application process. So we're going with, you're going to prepare, you're going to review your narrative, you're going to review the application questions and start thinking about them, and you're going to review the selection criteria and let those things guide you. Now, when you get into the e-procurement environment, I want you to know there's a 4,000 character limit, which includes punctuation and spaces. So each question that we ask has a 4,000 character limitation. The e-procurement system, despite having this limitation, is not going to actually do an accounting for you, and they won't tell you that you've gone over the limit. Additionally, the way that e-procurement works is that once you've set up your application and you've submitted it, you get a PDF copy. You can get a PDF copy at the end, but once you've submitted it, it's kind of sucked away and you're never going to see it really again. So I highly, highly recommend to people that you want to save all your good language and save it in a Word file where you can do the character counts and make sure that you're not over the 4,000 character limit, and you have your answers as you put them in to the e-procurement system for your own records. We have had instances where people, like, literally they put in an application, they don't do the save, they are awarded, and then they have to ask the very embarrassing question of DFSS of, what did I say I was going to do? Because they can't, because you really aren't able to see that application and what you said after you've submitted it. It sort of becomes property, if you will, of the city of Chicago. And actually, we can see it, but even that's somewhat of a struggle. Just so that you also know, in terms of working, e-procurement was developed off of an Oracle platform. It works best with the Internet Explorer browser, which no one uses anymore. It also works well with Chrome, Firefox, and Safari. I can say that from personal experience. But if you are having problems with your computer and connectivity, you're having problems getting along with this system, I always tell people to try or default to that Internet Explorer browser, because that's what the system was designed to operate best on. Unfortunately for our applicants, but fortunately for the city of Chicago, the e-procurement system, knock on wood, has never gone down. So what happens, if you're having problems, you're getting bounced out, it will time out on you, but if you're getting bounced out, you're having problems, chances are it has something to do with the programming or software on your computer not getting along with the e-procurement software, and that we can help you troubleshoot, but we can't probably, we aren't going to be able to solve your computer problems. The e-procurement system is, like, for better or for worse, the thing has not crashed, knock on wood, in like 4 years. And that's how old it is. Another pro tip is, do not use the back button on your browser. When you do that, e-procurement will take you back, but it will stop saving your work. And then when you go to save it, it will give you an error message, which is a really, kind of nasty trick. I have fallen for that trick many times. It's super frustrating because you do all this work and then you go to save it and you get this weird error message, and then when you log back in, you realize that the past 15 minutes, everything you did was gone. And so just don't do that. Just save. This goes back to save often. So save often. Navigate through e-procurement. Use anything that's highlighted in blue takes you from one screen to another screen. Use those screens and just stay off of the back button on your browser. So let's go to the next slide. Thank you. Okay, so one of the nice features of e-procurement is that you can submit your application and later amend it up until the due date, which is March 18th, 2021 at 12 noon. And that's not 12:01, it's 12 noon. If you are late, we can't accept your application. I really, really hope that people will do their applications earlier. I would plan on taking 30 to 60 minutes to have the application go through. That you should give yourself plenty of time to apply, is what I would say. And it's not just a submit and whoosh, this thing is gone. It's, as you'll see, because we'll go through the screen, it's more like submit and then 20 slides later, your thing is kind of gone and you're not sure. So give yourself time for the submission process, and because this thing will kick you out, and then there is nothing to be done. We cannot accept late applications. The only way we can accept late applications is to resubmit the entire RFP, and everybody who applied will have to reapply. And we have not. There's a handful of times where we have done that, but it has not been because people missed the application deadline. If you're having problems with e-procurement, use the hotline, which is 312-744-HELP. I think, easy to remember. And just give yourself the time. We can see people I can see people when they are starting applications. I start tracking things. I can see who, I can say that, you know, for looking at, you know, 4 years of data of watching people do applications, generally speaking, people don't give yourself enough time. I would say, you know, our applications sometimes are very complicated and time consuming. They're not easy to fill out. The e-procurement system is not my favorite work environment, but this is the one that we're using. And so just give yourself time so that it's a relaxed and not horribly stressful experience any more than, you know, writing a grant is, or doing an application is kind of inherently stressful. So one note about using the helpline is it operates during business hours. That would be 9 to 5 Central Standard Time, Monday through Friday. And I would say as a if you email them, if you call them, they will try to get you, they will try to answer your question. If you leave a message, they will try to get back to you within 48 hours. You can call me. I don't have quite the same level of access, but you can call me for your run-of-the-mill problems, and I actually tend to pick up my phone whenever it rings. So, you know, maybe not if I'm sleeping, but you can call me outside of those business hours, and I will most likely pick up the phone and I will be happy to help you. I've written enough grants myself or applications myself that I try to be available to people because I think it's a stressful experience. So let's go to the next slide. So when we're talking about if you're a new agency, I just want to give you guys a heads up that the new agency, when you're going to put in the application for a supplier and to make an application to any City of Chicago bid opportunity, you are going to need to provide these 4 kind of backgroundy kinds of things. So we're going to want to see your articles of incorporation. That's going to be uploaded. We need an IRS affirmation letter. That's for anybody. We need to see it's a 501c3. It's a thing with your FIN number on it. We're going to need to see your CCR registration, which you can get from the sam.gov website. We need to see your DUNS number, and then we also need to see a certificate of good standing letter from the state of Illinois, basically saying that the state of Illinois, you know, considers you to be an organization in good standing. So just a quick sort of foreshadowing for if any of you guys have not ever applied for a City of Chicago grant or you know, contract, that this is what's going to be required of you. Next slide. So here we are. I mentioned before, it was foreshadowing that on technical assistance. So if you want to get technical assistance that doesn't include you speaking directly to another human being or tracking one down, you can go to, if you want to see what we have in terms of other RFPs coming up, we're going to be doing a lot of RFPs in the next 6 months for a variety of different targeted or vulnerable populations that DFSS serves. They're all are going to get posted on the alert section of the DFSS website, which is on the City of Chicago website. If you want to get more help with procurement stuff, specifically the e-procurement stuff, here are your customer support at cityofchicago.org or that helpline. And if you just are a person that likes to do it on your own a little bit, or you want to do a video, listen to it, watch a video, or see screenshots of what you're supposed to do, there are a lot of training materials up on the City of Chicago, this website. Additionally, you can email me. I have plenty of, I can download them for you and send them to you, or I actually have many of them I've written. So, I'll just send them from my own computer. But we really want to make sure that this experience is as pleasant as is possible, and that you feel as supported as you need to be to get this job done. I think e-procurement can be a challenging environment to work in. Our applications are technical, our programs are technical. We all appreciate your being willing to consider applying and making an application, and we want to just make sure that it's a smooth sailing as possible. So let's go to the next slide. So as I alluded to before, when you ask questions, if we have anything that we need to add or change, we do it through the amendment process. In the next couple of slides, I'm going to talk to you about how to accept an amendment, and I'm also going to talk to you about how to do the submission process. So you'll see a series of screenshots. This webinar is going to be part of the amendment that we post, so that will be captured The screenshots will be captured if you want to refer to them later, or if you want to refer to them before the amendment gets posted, you can just email me and I will send you the, I can send you the screenshots on how to do these things and a number of other things if you're a screenshot loving kind of person. So let's get started with how to accept an amendment. So we do an amendment for almost all of our RFPs. As I said, the amendment captures any changes, answers to questions, clarifications that we might have about the RFPs that we are putting out on the street. The city, the e-procurement system really wants to make you, as you will see, really wants to make sure that you accept the amendment and that you've read it and that you know what's in it and that you understand from a legal standpoint, because that's somehow how the city works, that you are being held responsible for all of the information that is in that amendment through the acceptance. So that if we said, hey, in the amendment, like, only use purple ink for your signature, which actually is a bad example because you can e-sign. But if we have something and it's in the amendment and you don't do that, you can't go back and say like, well, nobody told me, because it was in the amendment, and this amendment process goes over and over and over again, that you should be aware of what's in the amendment. You should understand that we assume full responsibility, that you are cognizant of what's in the amendment and that you accept it. So here we are at the beginning of the amendment process. If you have not started your amendment or your application yet, you would do this on the actions bottom. It's an actions thing over here on the right-hand side. It's going to say create quote. When you hit do the create quote from the pull-down box and you hit go, that is going to how you start your application. If the amendment, the RFP has already been amended, you will get this little warning thing that says, hey, there's an amendment that you have to accept before you can start your application, and that you will go to the view amendment history, which you see is in this sort of bright blue, and then you will view the amendment, you'll accept it, and then after you have done all the acceptances, then you will be allowed to start the application. If you've already started an application, you will get something similar. It will be a slightly different screen, but you will still have to view the amendment history. For those of you who are not familiar with e-procurement, pretty much everything in blue, in this bright blue or underline, that's going to be, or if it's in a pull-down box, those are the things that you click on to get to something else, to get to more information. So we're going to, in this case, you're going to, as part of the accepting and the amendment process, you're going to hit view amendment history, and that will take us to the next slide, where you begin the beautiful, beautiful process of accepting your amendment. So to begin the acceptance and acknowledgement process, you'll get to this screen, and in here you will see, the document has this these numbers. That's the RFQ or the RFP number. The comma 1 means it's been amended once. To look at that screen and see what's in there, what the changes are, you will click on that. You'll notice here in the middle there's an amendment description, and that's like a little one-sentence thing that I write up that basically says what's in the amendment. And then to review the changes and review the amendment document, you would hit on this little eyeglass or infinity button. People go back and forth about, I think it's eyeglasses, other people think it's an infinity sign. But anyway, you click on it, and then you would see also that would bring you up to the amendment document. When you're done with all of that, you're going to hit the acknowledge amendments button, which is on the upper or lower right-hand side of the screen. Everything, all acknowledgement and signing and submitting always happen, the upper right-hand side of the screen in e-procurement. So then you'll acknowledge the amendment, and that will take you to the next screen where you accept your acknowledgement. So here you go, you're going to hit this tiny box on the left-hand side saying that you accept the terms and conditions of the RFP and acknowledge the changes made to the RFQ amendment in the document, and then the amendment document name. And then you're going to hit acknowledge, because you've accepted and you've acknowledged the amendment. Then will be taken to the following screen, where you confirm your acknowledgement by saying clicking on the box that says yes. So you've confirmed your acceptance of your acknowledgement, and that will take you to step 5, where you confirm your acknowledgement to the amendment, and you'll hit yes again, and that will take you to the next screen where you accept the terms and conditions. So you're first going to click another little tiny box on the bottom of the left-hand side, and then you're going to click accept on the bottom or on the top of the right-hand side of the screen that you have accepted the terms and conditions. And this is the final step in acknowledging and accepting and confirming and accepting some more on slightly different things, the amendment. And then you'll go on to the next thing, which is how to submit an application. So if you haven't gotten enough bureaucracy, let's just jump right into the how to submit an application. We're going to go to the next slide. So as I said, give yourself some time for this. Like, just give yourself some time. Please give yourself some time. There is nothing worse than watching people with like minutes to go see that they're just starting to submit the application and like feeling their pain as e-procurement does its very thorough job and like wastes minutes with its minutia and its sometimes cryptic messaging. So here you go. When you're ready to submit, start by saving your draft one last time. If you're a compulsive draft saver like I am, or wing it and don't. But you're going to save your draft, and then you're going to hit this button that says continue. When you click continue, you're going to go to the next screen. What happens then is e-procurement reviews your entire application for what it considers to be an error. We're going to do the 2 most common errors that you might get. If you get a different error, give us and you don't know what it is. Most of the time, I find the keywords are a little cryptic here, but you can figure it out. Everything that you need to figure out what e-procurement is telling you in terms of an error message is usually on the screen if you look carefully. So you'll see here that the error message that you have is you must quote on at least one line in the RFQ. You'll note right below, and there's a next screen. It's kind of, I've blown it up a little bit, that the error message, it usually says something you didn't do. And right here it says you must quote on at least one line, and right below the error message there's a tab that says lines. In this case, we require that you give us an uploaded budget in Excel. For contracting purposes, the lines need to be filled out, but we don't use those as part of our application review or evaluation. And so that, so sometimes you can put in pretty much any number you want. We're not going to look at it. We love it if you do, because it makes our contracting a little bit easier when people fill out those lines. But when you don't, you get an error message. So that's a very common one. Let's go to the next one, the next slide. And we do another one. This is the quote value is required for the requirement first name. And in this case, what we're talking about is that requirements is e-procurement for like application questions. And then a quote value is e-procurement for basically your text answer. So remember, this is set up for all procurement, not just social services, but the procurement of tires and road salt and all the other things the city buys. So when it says the quote value is required, they're basically saying you didn't fill in a question. So the question actually was first name. What we want you to do here is go to find the question where the answer, you did not put in an answer, and then put in an answer, which in this case would be your first name, and do that. And so then you'll answer that, and you'll hit continue, and you'll hit review and then we'll go to the next slide. So once your application is free from errors, and when you hit that original submit, don't be surprised if you get like 6 errors, because there's lots of little glitches that sometimes happen. I mean, sometimes you might not, but in the end of it all, like don't let the number of error messages that you get be too, it's not, the errors are usually pretty minor, so don't get too upset. Like, don't let the big list of like red things saying arrows trigger you into feeling panicked. So once your application is free from errors, you're ready to proceed and submit. At this point, click and continue will put your application into this review and submit page. And at that point, and there's subsequent screenshots, we'll show you this, you'll get like one really long screen that you can scroll through that has all of your answers to everything. It will demonstrate, it will show, let's go to the next screen. It will have all of the attachments you put on. It will put all of the answers to all of the different requirements, all of the quote values to all the different requirements that you've given us. And it is your last chance to review all your data and confirm that it's accurate and it's the way you want. You can see all of your attachments. And then when you're done, you scroll to the bottom of the screen. So we'll go to the next slide. And at the bottom of the screen, so exciting. At the very bottom of the screen, you will be able to go to the next thing, which is part of the submission. So very quickly, how does it, at the bottom of the screen, as I said, there's this electronic signature box. So you'll see there's a little box, and then you put in your name and your title. Putting your name and your title first. If you check the box first, even though it's on the top and it seems logical to check the box first, you'll get an error message. So you're going to put in your name, you're going to put in your title, you're going to check the box, and then next slide. You will see a submit button. So you're going to click submit, and that will take you to the next screen. And you will see this submittal confirmation screen. So the e-procurement system is going to send you a confirmation email within 24 hours of your submission. They're going to send it to the email address that you put in as the filler outer of the application. But if you are a person that wants information quicker, do not hesitate to email me or call me, because I can see when you've submitted immediately, and I am happy to look it up and make sure and confirm with you if you want that immediate confirmation that your application has been submitted. So that is really all that I have to say on the e-procurement system. This is now the time, if you have questions about the application, or anything about this, the scope, the narrative, the program, anything that you want to ask, this is the time to do it. I see that we have 2 questions already. And I'll defer to Karen and Stacy for the answers, unless it's an e-procurement question, obviously. So let me unmute Stacy. So let's go with, can you repeat funding availability?
Yes, let me pull that up.
I've got it right here, Stacy, if you want.
Oh, okay, great.
Hi, this is Karen. So let's see, individual and family counseling is $30,000. Group therapy and support groups is $40,000. And gap filling services are $46,200. Now keep in mind, this is a partial year, and so those funds will be prorated to reflect the amount of time of the grant, and then we'll begin again in the following grant cycle year.
Okay, so the next question was, aside from the required attachments of job descriptions and resumes, is it also necessary to upload your specific response to the other organizational attachments that are listed in the solicitation, which is like the SAM certification, your audit, or is it okay to upload the general organizational documents into your organization's iSupplier admin tab if they're not already in there? Laura, you do not, you could go either way. We always appreciate it if you bother to upload it into the attachments, but if you don't, we can find them. It takes a little bit, it's a little bit extra work, but we can find them. So you go, as long as you do the organizational attachments, I mean the required attachments, that's what we're really looking for, and we are really, and all the other stuff we will find, but just make sure that it's in, you can do it in your general orgs, but just make sure that they're in the general orgs and that you have the most updated copies. It's not like something that somebody threw up there 3 years ago. So here's, what is the geographic requirement? Must services be offered citywide, or can they be limited to a particular neighborhood?
Stacey,
Sure. Yeah, we're requesting that it be citywide services. So to be able to service, north, south, west, central of Chicago.
And then can you go over gap filling services?
Sure. So gap filling services. So these are goods and services that we are able to provide, to the caregiver recipient, that they might need access to different services that maybe is not covered by other resources. So like I said, for example, we've done incontinence pads, we've done grab bars, bath chairs, things like that where, maybe their insurance doesn't cover that, but we're looking to be able to provide that item for the older adult. Karen, do you have anything to add to that?
Well, I'm thinking about insurer. I'm sure many people this year have had to buy additional things like face masks and cleaning supplies. So really the goal is to support the caregiver in their care of the care recipient and to take a flexible approach towards trying to reduce barriers that may shorten the amount of time they can be a caregiver. Is that a good way to put it, Stace?
Yep.
Great. These are great questions. Thank you. You're welcome, Ms. Taylor-Lewis. What other questions do people have? Any? We love questions. Okay. Is there anything else, Karen or Stacy, that you would like to, that there's anything else you want to say in regards to the caregiver RFP? Here's another one. Can agencies partner together to submit one application?
Stacy?
Yeah, that I'm not sure about. I mean, I know we talk about subcontracting. I don't know, Julia, in your experience in the past, if there's been,
Yeah, the city generally submits, you can partner together. What's going to happen with that is that the agency or that is going to act as the fiscal agent to the partnership is going to be the applicant. And so even if it's an equal partnership, the way that the city's contracting is going to work with that is that the fiscal agent will be awarded the partner, and the other agency partner, even if it's a full partner, is going to come in looking like a subcontractor. We don't award two organizations jointly to work together. One has to come in under the other one.
Sorry, Julia.
No. Did you want to add?
Well, I was just going to direct Cynthia to page 15, section 2, eligibility, evaluation, and selection procedures. And the second sentence, I'll start it from the beginning, actually. This is a competitive process open to all entities, nonprofit, for-profit, faith-based, private and public, all units of government, and sister agencies. Respondents may apply as a single agency or in partnership with multiple agencies, where one agency serves as the lead agency for the partnership. So that's the fiscal agent, they take the money. And other agencies serve as subcontractors of the lead agency. Subcontracted agencies must demonstrate competence to implement programmatic elements, whereas lead agencies must also demonstrate financial strength and ability to comply with all administrative requirements outlined in the RFP. Again, that was page 15 and 16 of the RFP document, section 2, subheading A, eligible respondents. Sometimes it's a great way to really collaborate on the strengths of your organization.
You're welcome, Ms. Font. Then will there be another webinar on this? I'm jumping around. No, There will not, this webinar is being recorded. We will post the link to this webinar on the DFSS website, and it will be part of the amendment, so you can listen to it again, but we are not gonna have another webinar like this. If you have programmatic questions though, you can call Stacy or email Stacy and Karen. They will be happy to respond to you. Again, you can email me your program questions, but I'm gonna just defer to Stacy and Karen. Where will the slides be posted? The slides are going to be posted in the amendment, Ms. Precht. There will be a link to this webinar on the DFSS website and in the amendment, so that's where you can get to the slides. Here's a question. Can you please repeat the scope of services once again?
Sure, this is Stacy. I can go back to that. So there's 3 components to the services. That includes the individual and family counseling with a licensed mental health professional to provide counseling to the caregiver. There's group therapy and support groups to provide peer support and emotional support. And then there is the gap filling services, which is the goods and services component. We do have the optional service of training and education if there is additional funding available. And then just in terms of the numbers that we're looking to meet, it's found on page 13 of the slides, 150 assessments annually, 30 participants and 250 units for counseling, 70 participants and 156 units for support groups, and 100 clients and 100 units of gap filling services.
Okay, thank you. So one is, I went to DFSS office today to give them your agency's flyer, but they told me they have a list sent to them by the city of Chicago that I should register with the city. I'm not entirely sure on what question you have, Mr. Nuoso. I am not sure what flyer we would need. You should register your organization in iSupplier, but maybe we can take this conversation offline and we can email, or I'll talk to you privately, or Karen or Stacy will talk to you about how to resolve whatever, to get some clarity on what it is that you need and how to get you in the system. Again, so what was the prorated amount for this year? Could you repeat that again, Karen?
So unfortunately, I can't tell you the prorated amount because it will depend on each individual application that is submitted, first of all. Second of all, it will depend on the readiness of the organization to get started. And so I think that will vary both by application, by applicant, and also by the individual submission. So if you submit something for the full budget versus if you submit something that is $20,000 less, you can see how that would impact the amount that is prorated. Does that make sense, Julia? Julia, Stacy, is that?
Yeah. Ms. Lizama, is that the information that you were seeking?
I mean, you can anticipate if this was to start April 1st, which would be very quickly. The fiscal year begins October 1st. And so that would be 6 months into the year, right?
Right. I am looking to see cost per service. So I think that, Ms. Lizama, that we're moving away from a cost per unit for each service model. But do you want to speak more to that, either Stacy or Karen?
Sure. So it's actually on a reimbursement procedures to be able to do that. And as Karen mentioned, it would be from October 1st through September 30th. So for this program year, again, once the delegate agency will be ready to begin, that's when we'll start looking at that prorated rate.
Okay. Can we apply for more than one service or activity, like both counseling and gap filling?
It would be for all three. The only optional piece would be the training and education.
So yeah, so just to clarify, and this is in the RFP, we I believe are only looking to really do one contract for this opportunity, right?
Correct.
Yeah, so we're not we're not looking to have people apply for just one thing or another. We really want to find somebody who can do all of it. So.
Julie, I think someone asked if
Or
the slides are going to be emailed to participants, and I think we just posted to the website. Isn't that correct?
No,
Yeah, we are. The slides will not be emailed. They're going to be posted to. A link to the recording is posted to the website. Slides themselves are in the amendment.
No, great. I meant, did you see the and Karen, did you see the question about, aside from the required attachments, job descriptions, resumes? Did you go over that? Do you guys see that question? It's near the top.
Yeah, we answered that one. Yes, we answered that.
And the geographic requirement?
Yeah, some of these questions,
Sorry,
some people, we have the same questions.
Okay. Just wanted to make sure.
So let's see if people have any more questions.
I think there's a statement or something towards the end. Did you see that?
How will the reimbursement process be handled? Excellent question. I'd like to answer that.
I'm looking in the RFP for the particular page for that.
So reimbursement generally, as you might know, the city of Chicago doesn't do any, we don't do we don't really do any reimbursement. We operate only on a reimbursement basis. So we don't cover or give you money up front. You do provide the services that you have been contracted for, and then you submit a voucher for us to do, and then we pay out. So it's very important from a budgeting standpoint that you have some upfront money to handle the expenditures of, the expenses associated with running the program to which you have been contracted. The reimbursement, so you're going to do you'll provide the services, you'll reimburse the city, or you'll send the city a voucher for those services, probably on a monthly basis, but I think you can probably do it on a weekly basis if you need. And then within 30 days, hopefully, if everything in the voucher is done correctly, you will receive your money for the work that you have performed. There is a contracts unit that's set up specifically to help people with the vouchering process. There's training that you can attend from OBM and our department on how to do, how to voucher correctly. But it's important for you to understand that we don't give any money up front, that everything is going to be on a reimbursement basis, that if you don't voucher, you're not going to get paid, and that I would plan on, your vouchers might be turned around in 2 weeks or a week, but I would plan on your vouchers not being turned around for a month, like at least.
Julia, this is Karen. If there's nothing else on that question, I see that Stacy submitted a question over email. May I invite myself to read that out?
Sure.
Go ahead. Thank you.
Are respondents required to be on the live webinar to apply, or for those that did not attend, can they watch the recording and still apply?
That is an excellent question, Stacy. We would like anybody who is interested and feels qualified to apply, and watching the live webinar or watching a recorded version of the webinar is not part of what we require for them. So No, they can in fact apply even if they haven't watched any webinar at all or have watched a webinar for something else. But yeah, we strongly suggest that people listen to the webinar because there is a lot of good information on how to do the application. It's a nice way to familiarize yourself with the RFP, but it is a completely voluntary experience to engage in the webinar in any way, shape, or fashion. So now here's another question. How many grants will be awarded? There will, as I think we discussed, there will be one contract awarded for the whole package of caregiving, you know, and the different aspects of that as broken out in the RFP, and as Stacy already responded. That doesn't mean that you can't subcontract out to do some of the stuff that maybe your agency is a little bit weaker on, but we are looking to award one contract for the whole city to do everything.
I see one. On average, how many applicants do you get? I think that's by RFP, right?
On average, it depends. I mean, for this RFP, I would have to check. It's been a couple of years since this one was put out, and it might have been put out with a slightly different scope to it that had fewer components, I believe. So I honestly can't tell you that right now, but I can look it up and I can address that in the amendment.
It looks like on page 15, prior year statistics for this program. Sorry, this is Karen. Section G. Section 1, excuse me. Subheading G. Prior year statistics for this program. 1 application received. 1 project funded. Range of funding was $116,200.
There you go. I think that the scope might have been slightly different for that, but that will in fact give you, that does in fact give you the information on how many applications we got. Here's a question. Could a caregiver receive individual mental health services and group therapy and can be considered as an unduplicated client for both?
I like the way they're thinking. Stacy, I think.
Yeah. That's a good question. I think, you know, let's get back to you on that one because I think it was unduplicated for both, but you know, I would have to go back and check.
Yep. So we'll address that in the amendment. Miss Daisy, thank you.
Yeah.
I see. Please explain where we will find this recorded webinar on the DFSS website. Ms. Maryhill.
It will be on the DFSS website under the alerts section associated with the caregiver RFP. The link will get added to that original alert about the caregiver RFP.
And forgive me if I'm mistaken, Julia. Is it also on the e-procurement site where the listing about open RFPs is?
The webinar link will be included in the amendment, which will be part of the application, but you will have to wade through the amendment. If you're just looking to hook on, you know, like listen to the webinar, you can go to the DFSS website where the link is posted, or you can go to DFSS's YouTube channel and it will also be there. I do not know how to get to the YouTube channel, so I am not going to tell you how to do that right now, but I know that DFSS has a YouTube channel and that the websites get, you know, the webinars get posted to the YouTube channel, and then I post the YouTube link to the DFSS website.
Excellent. Excellent. Thanks, Julia. My Friday nights are booked now.
Right. I know. You're going to just go through and listen to old webinars for the past, 7 years. So will program participants register through the City of Chicago website, or will the selected agency need to develop a website for participant registration? That is an excellent question.
Excellent.
So these are for clients that are wanting to participate in the program.
Yes.
Yes. So we actually have at DFSS Senior Services our intake and assistance line. So anyone wanting to participate in any of our programs would have to go there first. And so there's a general number that's 312-744-4016, and that's our information and assistance line. All those applicants then get referred to our delegate agencies to provide the service. However, that doesn't mean that you can't take clients of your own. It would just still have to go back through the system. And so let's say someone comes to your agency directly for the service, the INA, the information and assistance, would need to be notified so we can track that in our system.
Yeah, and thank you, Stacy. That's excellent. Ms. Avia, I would draw your attention to page 7 of the RFP, which this is the section C, program requirements, subheading 3, intake and assessment. And there's the information about the way that the calls are onboarded through INA. And then also, I think, Stacy, you said this, but for folks that if you were to have your own referrals to send through, you would just send them to INA. And you'd be working with the caregiver team here in that capacity as well. Did I get that right, Stacy?
Yes, that's correct.
Awesome. So yeah, good questions.
You get a gold star already.
So let's see, any other questions? So you can see here, the slide is up on the slide here has the program questions. It has the contact information for Karen and the phone number for Karen, as well as the phone number for myself and my email. Karen, do you prefer to be called or do you prefer to be emailed? What's the best way to get a hold of you if you have a question?
Well, I guess probably by email, so we have written documentation of everything's a good idea. Because
yeah, that
amendment, isn't that right?
Right, because if we get more questions and they're like, you know, more questions sometimes means we do another amendment. So.
Right. And the other question, and the other place I would just draw everyone's attention to is on page 6. And as you are looking at again, this is under program requirements, the first area, best practice and evidence-based standards. And that draws your attention to 2 resources, the Benjamin Rose, or it's called Ben Rose now, Institute on Aging. They have a website, it's free on best practice caregiving. And it's got a database across the board of resources. And then also Family Caregiver Alliance. It's been a tremendous resource in this area, policy documents, fact sheets, caregiving strategies, and program ideas. So, and a bit of an additional explanation of some of the different areas. But there are some resources to kind of guide you as to looking at best practices there.
Well, if there are no further questions, I think that we will conclude the the webinar so that we can now start working on the amendment. I would like to thank all of you for coming to today's webinar. I really love it when people come and have lots of questions and really use the time and access to their advantage. We are very much looking forward to reading all of your wonderful, wonderful ideas and hopefully working with some of you to do this very important work for the seniors of Chicago. Thank you.
Thank you, Julia.
Yeah, thank you, Karen, and thank you,
Tom.
and thank you, Tom.
Thank you all.